Partners and friends, good afternoon. I'm here with you today on behalf of National Health Service of Ukraine with our weekly briefing on NHS strategic scope of activities and what's been on our agenda this week. This week, on April 1st, there has been exactly 3 months since the full-scale launch of the program of medical guarantees in Ukraine. And exactly 2 years ago, primary healthcare facilities, from which the healthcare transformation started, switched to the new financing system with the money follows the patient principle. Positive results of the primary healthcare changes have been felt since the first year by both patients and doctors. Thanks to the new financial system, healthcare facilities received money sufficient to both raise wages by 2-3 times and to fund capacity development. Patients received opportunity to freely choose the trusted doctor and additional services to receive care in more comfortable conditions. Patients note that the quality of this healthcare has increased. And as of today, more than 30 million Ukrainians, which is more than 70% of Ukrainian population, have signed declaration with their physician. On April 1st, 2020, the second stage of changes in Ukraine was launched. The specialized healthcare facilities shifted to the new financial system. The NHSU contracted 1,658 facilities, among which 59 private. As of now, NHS has paid 14.5 billion to these facilities for the provided services in April-June under the program of medical guarantees. Let me note that almost 1,000 hospitals have received increased financing under the program of medical guarantees compared to the state subvention last year. So they have capacity to provide the patients with wider volume of medical services, increase the service delivery quality, and raise salaries of doctors. Beyond that, due to COVID-19 pandemic, NHSU additionally contracted healthcare facilities for COVID-19 related service packages in May. As of today, these facilities received almost 1.7 billion hryvnias for the healthcare provided to patients in April-May. Let me note that since July 1st, we will implement some changes in financing of the specialized facilities. Particularly, the tariffs for the emergency healthcare, heart attack and stroke will be increased. At the same time, due to COVID-19 related quarantine prolongation in Ukraine, the payments to the facilities for the surgery and inpatient healthcare within global budget were continued until October 1st, 2020. It means that these service packages will be funded entirely within the global budget. One of the most crucial problems in Ukraine health system is early cancer diagnostics. Every year, around 140,000 Ukrainians find out that they have cancer. To avoid late detection, which reduces the chances for successful treatment, this year, cancer early diagnostics has been defined as priority service in the program of medical guarantees, which includes 6 instrumental investigations for early diagnostics of the most widespread oncology diseases. These investigations include in particular mammography and colonoscopy. 1 billion hryvnias is allocated for these services this year. The NHSU has contracted 683 healthcare facilities for cancer early diagnostics, 34 of which are private. As of today, doctors have issued around 38,000 endoscopy referrals. 1/3 of these referrals have been already used. According to our data, cancer early diagnostics have been already provided to almost 14,000 patients. So thanks to this program, we are able to increase the number of early detection of cancer, what will improve the treatment outcomes for such patients. Thank you for your attention and see you at the next briefing.